I recently had a polite exchange with a viewer who basically disagrees with my statin stance, and it got me to thinking about how is it we could both look at the same statistics yet come to such opposing viewpoints on whether the statin treatment was appropriate or not. And I realize it comes down to our personal values. So today, let's take a deeper look at how your personal values can affect whether you accept or decline statin treatment. Stay tuned. For the purposes of this video, we're going to assume your doctor has just recommended that you go on statin therapy, and you have a decision to make. Now, I understand that a lot of my viewers aren't in this situation. They've already made that decision, but I'd like you to bear with me and pretend for a while that this is what you're faced with, because if you've already made a decision, this may help you be a little more comfortable with that decision that you've already made. There are a lot of things that go into the decision, and first really is your metabolic health status. At its core, that's why the doctor is recommending that you go on the statins. Even though that's not the whole story for this discussion, we're going to assume that you have a 10-year cardiovascular event risk. That's the basis for the recommendation. At best, it's an estimate. We've got to start somewhere. Another input into your decision should be the guidance that your doctor is providing. I already did a video on questions that you should ask your doctor, which you may want to watch for more information on that. And finally, and this is the part that many doctors and patients miss, your personal values and life goals and how they will affect your decision. So that's what we'll be discussing today. For this exercise, I'm going to present 6 questions that have to do with our personal values. There's no right or wrong answers to these questions. There's just your answer and there's my answer. Maybe the same, maybe different. Doesn't mean that yours is better than mine or that mine is better than yours. What it means is yours is the right one for you, mine is the right one for me. So what we're going to do is put out a values question in each of these areas. The first one we're going to talk about is risk tolerance. And then we're going to give 3 answers to this question, kind of on a spectrum. An answer that would tend towards our rejecting the statin treatment, a middle of the ground answer, and then an answer that would tend towards telling us we should undergo the treatment. Again, no value judgment on this. I'll tell you what my values are, but if you choose something different and you end up selecting statin treatment and it matches your personal values, then that's perfectly fine. I'm also going to use a sample patient that I'll refer to every once in a while. We're going to say her 10-year risk is 11%. That's a 10-year risk of a cardiovascular event. She gets an absolute risk reduction of about 4%. And I arrived at that just by accepting Lipitor's famous ad that says you will get a 36% relative risk reduction by taking the statin. So that translates to an absolute risk reduction of 4%. And the remaining risk will be 7%. The number needed to treat in that situation, a 4% absolute risk reduction, is 25. So we would have to treat 25 patients like this for 10 years to avoid 1 heart attack. So here's the question. How much risk are you willing to accept? Would you answer this by saying, risk doesn't bother me, you only live once? I accept some amount of risk as a part of living? Or I want to reduce my risk with every available resource? Depending on how you answer this, and you can be anywhere in between, it'll affect your decision. In my case, I'm kind of in the middle. I accept some amount of risk as a part of living. It's just a matter of what the threshold is. Next, we may look at, well, what is the acceptable effectiveness that you feel you should get from undergoing a treatment such as this? How much risk reduction from a treatment is acceptable? I want the treatment to provide a very high reduction before I will take it. I'll accept an intermediate level of risk reduction, or any amount of risk reduction is better than nothing. Well, if your answer is closer to the top there, I want a treatment to provide a very high risk reduction, well, then we can ask, well, what is a high risk reduction? One of the things I want to point out here, though, is that when we're told that you're getting a risk reduction of 4%, let's imagine we have 100 patients. Does that mean that each of the 100 patients somehow benefits by 4%? Well, that's not really what it means. What it means is 4% of those patients, 4 of those patients will receive benefit from the treatment, and the other 96 won't. 89 of them will be because they didn't have a problem in the first place or weren't going to have a cardiovascular event. 7 of them are still going to have that cardiovascular event, and only 4 of them are going to avoid the cardiovascular event. Mathematically, you can say, well, that's the same as a 4% risk reduction for each individual. But it's really not the same when we get down to it. So this is another input into your decision. The next question is, how much in adverse effects are you willing to put up with? Is your answer, I'm not willing to accept any adverse effects? I'm not willing to accept adverse effects that impact my quality of life, or I will put up with a lot of adverse effects in order to reduce my risk. My position is this middle one. I'm not willing to accept adverse effects that impact my quality of life. Now, we also have to put this into the context of what medication are we talking to. If I've been bitten by a rabid raccoon, well, I know I'm going to get adverse effects from the vaccine, but I'm going to take it anyway because rabies, for all intents and purposes, is 100% fatal, and the vaccine, for all intents and purposes, is very close to 100% effective. It's also temporary. So yes, I'll put up with the pain of the injections or whatever swelling, or maybe it makes me very tired and I have to take a week off from whatever my normal activities are. But for that, I'll do it. I might not want to do that for a lifelong drug, and we're going to get to that later. How about your lifestyle? There's two questions kind of related to lifestyle. Are you willing to make lifestyle adjustments to reduce risk? If your answer is, I'll do whatever it takes, meaning you'll add an exercise routine, you'll change your diet, you'll get more sleep, you'll somehow reduce your stress, that would lead us to maybe refusing the treatment. If you would say, I'd like to try changes and see if I can sustain them and if they do me any good, okay, there's a middle ground. Or would you say, I like my lifestyle as it is right now without making changes? You're happy with your life and you understand that you have a risk that you want to reduce. That would lead you towards accepting the treatment. Now, if we ask the question, are you willing to make lifestyle adjustments to tolerate adverse effects? You'd probably reverse these answers. In that case, I would say, I like my lifestyle as it is right now without making changes. That would lead me to refuse the statins or to get off the statins if they're interfering with my quality of life. And as an example, I couldn't exercise as much when I was on statin. I said to my doctor, I exercise strenuously and I'm not able to do that as effectively anymore. She told me, maybe it's time for you to stop exercising so hard. That to me is not an acceptable answer, especially since I was in my 50s at the time. Wasn't elderly or anything like that. On the other hand, for that question, are you willing to change your lifestyle to adjust to adverse effects? If you say, I'll do whatever it takes, then that's saying that you'll put up with the muscle pains if you have them, or any mental fog that you have, you'll try dealing with that the best you can because you're getting this risk reduction. Now, if you don't have any of these adverse effects, well, then that really doesn't come into play. The next value judgment, how much trust do you have in the healthcare system? Would you say, I believe the healthcare system is geared towards keeping me sick and on meds? Do you believe that everyone is trying their best in an imperfect situation? Or do you believe that the healthcare system is giving you the best chance at living a healthy life? Now, I'll tell you where I am on this one. I would have started out with that bottom answer, that the healthcare system is great, it's given me the best chance. And if it comes to like trauma care or something like that, our healthcare system is actually pretty good at that. It's these chronic diseases where it falls flat on its face. So I'm somewhere between, I believe everyone is trying their best. I don't think everyone is trying their best, but I think a lot of the clinicians on the ground are trying their best in an imperfect situation. But the healthcare system is geared towards keeping me sick and on meds if we remember to include the pharmaceutical industry as part of the healthcare system. So what's your willingness to take lifetime drugs? Are you comfortable with taking pharmaceuticals for life? Is your answer, I am very uncomfortable with the idea of being on medications at all? Something more in the middle, I would like a criteria for getting off the medication? That's kind of saying no to lifetime drugs, at least potentially. Or would you say, I'm okay with taking a drug for the rest of my life if it is reducing my risk? Again, I want to emphasize there are no wrong answers here, and I don't want to imply that you should be giving the red answer or the yellow answer as opposed to the green answer here. This is just personal values. Where do I stand? I'm kind of in the middle. I'm uncomfortable with the idea of being on medications at all, but sometimes they're necessary. For example, if I get bitten by a tick while I'm out hiking, I'm going to take some doxycycline or whatever to prevent Lyme disease. But that's just a medication that runs its course, and then when you get off it, you're done. If I'm going to be put on something like, say, metformin, I want to at least know what criteria is it that if I meet, I can get off the metformin. Problem with statins is I don't see that. No doctor says when your cholesterol levels gets down to whatever target they want to give you, they won't say it's okay to get off statins because they know full well that the only reason you've achieved the target is not because the statin solved any root problem, but because they're keeping it low. So how you take these values and apply them to your decision is up to you, but they are important. Your personal values, your feelings matter. They're an important input to the decision. Now, these aren't the only values that you'll want to consider. There may be others that you can think of, but the point is medical professionals should not impose their values on you. A lot of times I see that in the comments. I told the doctor I didn't want to take this for such a small risk, and they came back with some snarky comment about how, well, it's your life, you're going to die or something like that. They should respect your values. If your doctor is not respecting your personal values, then perhaps it's time to get a new doctor. The medical profession also has to recognize that it is throwing value judgments out all the time. The standard of care that says 7.5% 10-year risk is the threshold for being eligible for statin treatment. That is a value judgment. The statement that benefits outweigh the risk, I see that all the time. Even in articles that explain the adverse effects, then they'll say, but the benefits outweigh the risk. Well, that's a value judgment. And it's also different for each individual, not just because of their personal values, but because of their personal experience may be different. I mean, if the patient gets rhabdomyolysis, then that's very different than a patient who doesn't get any adverse effects. The point is, we see this all the time from the medical profession, and they're making value judgments that they really can't do for us. It's up to us to apply our value judgments to our decision on whether we take statins or not. So I hope this will make you more comfortable with whatever your decision was. If you've decided, I'm going to accept statin treatment, that's fine. It matches your values, and there is absolutely nothing wrong with that. I want to emphasize that again and again. I'm making no value judgment on your values. And if you've decided that you're going to refuse or decline statin treatment, and that aligns with your personal values, then you should be comfortable with that decision. Are there other values that I've missed that are important to you? Put them in a comment. If you appreciate this content, please like, share, and subscribe. And if you haven't seen this video, I recommend you take a look at it now. Thanks for listening.